Hi, I'm Meshal Malik and you're watching Indus Special. Cancer is the second leading cause of death globally. In 2018, 1 in 6 deaths was caused by the disease. The burden and threat of cancer is increasing globally, but there is inequality in how it is impacting different people across different places in the world. Approximately 70% of deaths from cancer occur in low and middle income countries. What's even more frightening is that the World Health Organization predicts an 81% cancer jump in these countries in the next 20 years. This means that people in low and middle income countries will increasingly become the most vulnerable. On today's show, we take a look at the reasons why cancer cases are rising and how we can find a way to fight back. Joining us for this today is Dr. Edmond Fernandes, who's a physician and community health physician, joining us from Mangalore. Also joining us is Mr. Achike Chode, who's an analyst joining us from Lagos. And joining us here in the studios is Dr. Azmat Majid, who is a health specialist focusing on clinical and therapeutic nutrition. Thank you all for joining us and welcome to the show. Dr. Fernandes, now I've stated a couple of figures here. We're talking about the global rise in cancer cases, but specific rise of cancer cases within low and middle income countries. What do you think is the cause for why we're seeing this happen, especially in developing nations?
The issue is multifold. I mean, if you look at globalization as a norm, low and middle income countries are also part of it. So naturally, the exposure to cigarettes, the exposure to pollution, both air pollution, water pollution, the exposure to dietary patterns are all in concert, contributing to the factors of carcinogens which thereby lead to cancer. And if you also look at government policies in low and middle income countries, the policies are scattered because they have to focus on infectious diseases, thereby meaning to say deaths occurring from malaria, dengue, tuberculosis. They also have to focus on non-communicable diseases, which is no longer a rich man's disease, wherein you have even children who do not have 2 square meals also suffering from the burden of diabetes. Adults also who do not have a lot to eat are going through diabetes with comorbid conditions like hypertension and cancer. So I don't think low and middle income countries are any more exempted from what was otherwise called rich people's diseases. And lifestyle is a major contributor to all of this.
Right. Dr. Fernandes, that's an important point. Lifestyle being a major cause for all of this. Now, these non-communicable diseases are also known as lifestyle diseases. And many of the reasons are due to how we proceed in our daily lives and how they're becoming more and more unhealthy. I want to talk about that more, but to the point of why developing nations are facing this more, and you raised a point of infectious diseases, other problems that governments have to battle with. I want to take this question to Mr. Achike Chode, and ask him about this. Now, the World Health Organization talked about this and said in the report that countries had focused their limited resources on combating infectious diseases and improving maternal and child health instead of fighting cancer. They've stated that this is one of the problems why we're seeing figures rising and jumping. But was there any way around this?
Well, there should be. I mean, every problem must have a solution one way or the other. But you know that the latter part of the 20th century, just like you have said, was spent, identifying the major problems or illnesses that were affecting people. These are the ones that people are used to. Malaria, then HIV, AIDS came on the scene, and some other ones like dengue and all that. And so a lot of concerted effort was made to battle that. Of course, infant mortality, maternal mortality were issues that governments, especially in low and middle income countries, were concentrating on. It is not so far back that cancer became a source of worry to most of these governments. I think a lot of them are beginning to wake up to that reality. But beyond that, again, apart, yes, the issue of a lifestyle, but beyond that, again, is the fact that even, and that calls to commitment, again, that calls to question the commitment, of the political elites in most of these countries, middle and low income countries. And that is the fact that even they themselves have also come to the realization that cancer is an issue. But how have they been able to tackle the issue of cancer? They have embarked on, what you would call health tourism to other advanced countries of the world when they are plagued with this kind of diseases. So in as much as, yes, we are looking for solutions, but it must be a solution that is also rooted within the country. The political elites must also realize that they have the ability, with the rich resources available, especially in countries like Nigeria. There is no need why, politicians and the elites, having recognized that cancer and some other diseases are a problem in the country, we continue to, yes, we continue to fixate attention on just themselves alone, and then why the majority of the people do not have the requisite health infrastructure that is needed to tackle this.
Now, you're making a number of important points here. We're talking about government policies, infrastructure, a number of things. But I want to take this question to Dr. Edmond Majid here in the studios. Now, Dr. Majid, we're talking about the government, we're talking about these high-up policies, but we also have to bring the individual into this conversation. What can the individual do? What are the lifestyles of the individual changing like, which is causing such a huge rise in cancer cases? What do you think is changing?
The first and the foremost thing is that we need to realize that we have made remarkable progress in understanding cancer in last 50 years. And this progress has not been capitalized by world health bodies and people responsible for finding a solution for it. The good news is that we have found, invariably, we have found links between diet and cancer. And the bad news is that we have lost the battle on cancer. If you just look at the disease statistics, it is so these are so profound that 1 in 10 people in Pakistan, they'll be suffering from cancer. If you look at the data, the Pakistan's demographic profile, and you'll find the incidence is increasing not by a few percentage points, but it is doubling almost every 3.5 years.
Right.
The most profound thing that we need to understand is that our diets play a key role in prevention and even in treatment of cancer. The first and the foremost thing is that we need to let people know that sugar feeds cancer. I'm talking about refined sugar.
Right.
If you look at a conventional imaging technique called PET scan, what they do is they take radioactive glucose and they inject it inside a person in order to find out what is the result of a conventional treatment. And this radioactive sugar is taken by glucose-hungry cancer cells, and they show themselves on that screen. If we can implement that in diagnostic, why can't we implement that in prevention and treatment? So we need to look far beyond our current medical discipline, what it propagates. We need to look far beyond that. We need to let people know that there are foods that help you rejuvenate yourself, and there are foods that are inflammatory in nature and might be carcinogenic. And these have been identified all over the world. One example that I can give you is mosquito repellents that we use every day in our house. And I'm sure people in Nigeria also use that because it is a tropical country almost. And similarly, use of phenyl in our hospitals and in our homes is also contributing to this risk. So we need to go far beyond what we are doing right now.
Dr. Edmond Majid, now thank you for listing out those basic things that we do that leads to this. But here's a point that is coming to my mind, and I'll ask this to Dr. Edmond Fernandes. Now, as we hear Dr. Majid talk about how all of these things lead to harm, almost it's as if we're inflicting harm upon ourselves. This information is, of course, not accessible to everyone. And one of the main issues about prevention or awareness is making information accessible. Where do you think governments are lacking are failing, especially when we talk about this sphere of the world, especially when we talk about Asia, making this health knowledge accessible to everyone?
So there are a few things which we need to remember here, Michelle. Like if you look at it in terms of WHO bringing out reports, what we also need to understand is look at the human life beyond these numbers. What's the worth of an individual beyond statistics? That is when it would start making sense. For example, what we need to think through is in one of the statements, WHO report has mentioned that tobacco is a leading cause of cancer, which we all know, and which the medical fraternity is well aware of. So what we also need to think through in all of this is, why do we still have smoking zones in airports? I mean, on one side, we are saying as a policy that bans smoking in public places, and I presume with all simple wisdom that even airports are public places. Of course, although we are building compartments for smoking zones, but why not start from these places of removing smoking zones from airports? WHO could also look at collaborating beyond governments with civil society organizations who are the drivers of change in the ground. I mean, with all the criticism being meted out to NGOs around the world, we also need to remember that these are the same grassroots foot soldiers of change who have brought us victory in public health, be it polio or be it any other disease for that matter.
Right.
So I think calling health as a human right is well accepted and welcomed. But what we need to work with civil society organizations is to make health a human duty and health as a commodity.
Right. Dr. Now, you're talking about something that should happen. It's an aspiration. It is the ideal case to move towards. But this is one of the biggest health debates. Mr. Achike Chode, maybe you can comment on this. Now, these companies have strong lobbies, whether we're talking about big GMOs, we're talking about the tobacco industry. That's one of the biggest fights we're having when we're talking about health. How can we make sure governments prioritize these measures, but also there is a balance when we talk about the influence these large companies have? Is there a way out of this?
Yes, and of course, especially in low-income countries, like countries like Nigeria, where some of these countries are particularly vulnerable to these national corporations. They have so much money, so much influence, and sometimes they use these influences negatively when it comes to trying to lobby the political elites to ensure that they remain in business. But I think there's also been a counterweight over the years. In Nigeria, for instance, I'm involved with some civil society organizations that have taken some of the cigarette manufacturing companies to task. And just recently, a law was passed against making things quite difficult for tobacco in Nigeria. And so that fight has been ongoing. It has been endless, but I think we are making a lot of progress, because we realize that look, you need to continue to put pressure on government, continue to give them the right kind of information, because sometimes government officials are not exactly as informed as we think that they should be. But by the time you are able to get to them, to get this information across to them, you'll be surprised that a lot of them would support some of these initiatives. And so we are doing the very best we can, I can assure you, and they will continue. We're making things very, very difficult for some of these organizations, the GMO foods and the rest. We've had, we've had to resist them as so many times in the country, and so they are beating the path of retreat. But it is something that is a battle that we cannot afford to relax, because once you do that, they're moving full time and take over the political economic space.
Right, Dr. Majid, now you made a really radical change, which was very simple, but you said that refined sugar is the root cause to all the evils we're seeing right now. That sounds very radical to many people, and it is a dramatic lifestyle change. When you put this advice to people, when you tell them that this is something that they must do, is it actually practically viable?
Let me share something with you. In 1931, Dr. Otto Warburg from Germany got a Nobel Prize when he discovered that all cancer cells are hungry for sugar. And once he discovered that, he was given a Nobel Prize. but it has been almost 100 years. No medical textbook that I have known, nobody ever talks about it. I have seen so many hundreds of my patients go through radiotherapy and chemotherapy and all those conventional treatments. I've never seen one oncologist tell their patients that you need to cut down on your sugar. They just step out of a chemotherapy regime and they are sipping on a glass of cola that contains 9 teaspoons of refined sugar. If we can use this concept that was discovered by Dr. Otto Warburg in PET scans, and we take radioactive sugar and feed it to cancer cells in order to find out, where they are and how effective our previous therapy has been, why can't we use it to create awareness? Why can't we tell people that, okay, there are some lifestyle changes that you need to make. You need to take something. Let me give you another example. If you have a diesel car, would you ever put petrol in it? No, you would not put gasoline in it. You would put the fuel that is recommended by the manufacturer.
But here's the question, and I put this to Dr. Fernandes earlier too. Why do you think this information gap exists? We're seeing such an alarm. Everybody you know knows of a loved one, a dear one, who is a patient who has been struck by cancer. This is information that you're saying is easy to somehow regulate within your lives. But why does this information gap exist? Why don't people know more about this?
Because there are so many vested interests. There are so many people benefiting from our ill health that it is so difficult to get it out. And these include corporations. And I sometimes pity my fellow community, all those doctors, who have never been taught the real biochemistry. When we are treating symptoms, we will fail. Cancer is a symptom of something that really happened for all those years gone by. And the reason it has not worked so far is because we haven't gone and addressed the root cause. And the first and the foremost thing in my opinion is that we need to inform the general public that there are some foods that are carcinogenic in nature. And as a matter of fact, there are hundreds and thousands of researches conducted by independent research, not sponsored by big pharma companies, who attest to the fact that these do play a contributory role in disease progression. So this is, I think, this should rest with the governments. This should rest with the civil society. And we need to educate our health professionals more on human biochemistry.
Right.
And we need to educate our health professionals more on human nutrition.
Right. Dr. Edmond Fernandes, now when we're talking about educating, also conducting more research, also dedicating more resources, the fundamental question that comes up is that of funding. Where is the money going to come from to deal with all of this? Now, on an international scale, when we see low and middle income countries battling infectious diseases, battling climate change at its worst, what do you think needs to be done at a global forum in order to help these countries?
I think there is plenty of money which is stored with the international community. But what we need to understand here is to drive in preventive healthcare built on an integrated scale. For a simple reason that you need to factor in the social determinants of health. We also need to look into the legal determinants of health and also look into the commercial determinants of health. Thereby meaning to say that on one hand, we are combating non-communicable diseases like cancer. We are also addressing climate change by acting into community development. And at the same time, we are shaping policy outcomes both at a sectoral level and at a national level. The convergence of opportunity lies largely with private sectors, given the way governments around the world are overwhelmed addressing different parameters of health. So private sector's social responsibility can be a game changer in terms of setting up community cancer hospitals or also specialty hospitals.
Right. Mr. Chode, this is an important point. Community cancer hospitals here. Now, the cost of treating cancer is, of course, a huge burden on anyone who has to incur it. What can be done for the common man, and how can our health systems at a national level, if you take the example of Lagos, how can they be strengthened in order to serve the common man?
Yes, well, you have the National Health Scheme that was passed into law some time ago. That makes some level of health infrastructure facility available to the ordinary person, especially the ordinary worker. And I think the government has tried to extend it also to members of the informal sector who are not exactly involved in regulated work activity. So that is one way of doing that. Now, these people have access to primary health care. We have primary health care facilities in many parts of the country. This is something that was, promoted by one of the health ministers in the past, and that has worked to a very large extent. But the reality is that there is a limit to what they can do, because some of these healthcare infrastructures at the primary level are just, involved in taking care of basic health-related issues, malaria, and all of that. When it comes to the big ones, and we're talking about cancer, you find out that there's a clear deficit. And of course, because just like you have, suggested, it is very extremely expensive. So government must look for a way around it. But again, one of the things I must look at, because you see, beyond policy, policy is key. But who are those that promote policy? Who are those that bring policy into effect? It is those who are in charge of running, the society, of running the government. And so we must have, committed political leadership that also understand the importance of ensuring, that the health of their citizens should be a priority. And so when you have that, then you begin to see them move in the direction of providing global health coverage for their citizens. That would also include healthcare. Because the reality is that there is a linkage between economic equality, and healthcare. And so when individuals are hampered by serious economic inequalities, it affects on their ability to look after their health. The same thing also applies to nations. So I think, of course, just like the WHO is saying, there needs to be some level of collaboration. Most of these countries cannot do it on their own. So there must be, whether they're going to set up special funds or whatever, to ensure that cancer is given the right kind of attention that it deserves. It is something that must be done so that the most vulnerable and the poor in society can also have access to it.
Right. On that point, thank you so much, Mr. Chode, for joining us from Lagos. Dr. Edmond Fernandes, just the last question to you. Dr. Majid earlier said in the show that we have lost the battle against cancer. Do you feel like that is a trend we can reverse in the coming years if healthcare facilities and infrastructure is strengthened?
I mean, I've been a proponent of optimism and hope. And going by a Russian proverb, it says, hope is the last one to die. So I'm sure that humanity per se will find its way out to fight the battle of cancer again. And we are very hopeful if we take early screening and case detection very seriously as a policy, particularly targeting cervical cancer, breast cancer, oral cancer, and also lung cancer, which are the common patterns of cancer around the world, and particularly in low and middle income countries. If we can make this as a duty of every state government and every central government in all these countries, I think we can reverse the trend easily. Right. Because we do have screening methods available. These are cost effective and not too expensive as what it used to be many years ago. So the opportunity to change the indicators of cancer trends lies within us.
Right.
What remains to...
Thank you so much, Dr. Edmond Fernandes, for joining us from Bangalore. Now, you mentioned screening and case detection early on, preventive measures, and that's something we're going to talk about in greater depth. But before that, we're going to go for a short break. Stay with us.